Hello and welcome to our EKG workshop. This is session 4. Today we are going to discuss ectopic beats. So we can have premature atrial contraction or PAC, or we can have premature ventricular contraction, we call it PVC. So if we follow the same pattern, we have a table. We said first we check the rate, then rhythm, and then we go down the list and we check everything in any EKG strip. So here first we look at the first strip, and we can see here if we want to determine the heart rate, the RR distances are not equal. If we see anything like that, we can quickly check and see when the RR distance is changing, measure that distance, and then measure the distance after that, add them up, and divide that by 2. If this distance is the same as the other regular RR distances, then we can think about an ectopic beat, and I will explain why we have that. So an ectopic beat, it could come from the atria, like we see here, or it could come from the ventricles that we see it in another strip in a little bit, and that is a white complex. So if it's a PAC or a PVC, it doesn't matter. It is an ectopic beat. It will cause a compensatory pause when the SA node is going to take over. So what happens is this: somewhere in the atria or in the ventricles, one fiber decides to fire earlier. So when that happens, if it's from the atria, then you see a narrow complex. If it's from the ventricles, you see a wide complex. But then the next beat, if the SA node takes over, is going to come a little bit late because one beat came earlier. The SA node is going to respect the rate that it was supposed to have. So the next beat has to come a little bit late. But if you add them up, it should be equal to a normal distance for 2 beats. So that's why when we divide it by 2, we get the normal RR interval in the beats before the ectopic beat. After we recognize that we have an ectopic beat, to determine the heart rate, it will be a little bit different, because now we can't use this RR distance. We have to see if we have regular RR distances and use those. If it is difficult to see which is which, we can use the last part of the EKG strip. We said if you have 12 lead EKG strips, then at the end you have throughout the whole EKG lead 2 that shows for, let's say, 10 seconds or 15 seconds. You can see the activity of the heart in lead 2. So based on the time that you took your EKG, so if it was for 10 seconds, whatever number of beats you have there, you multiply that by 6 and you get your heart rate in 60 seconds. If it was for 15 seconds, you multiply that by 4 and you get the heartbeat in 60 seconds. This is how you determine the heart rate in situations like that. Now you would look at the other elements. So after the heart rate, we will try to determine the rhythm. If before every QRS complex you have a P wave, which is the case, this is a sinus rhythm. In the case of a PVC, we look at the strip for a PVC, and we can see here that we don't have a P wave here, so this is not a sinus rhythm. This beat came from the ventricle, not from the atria. So this is not a sinus rhythm. Then we look at the QRS complex. After the rate and rhythm, we look at the P wave, and we see the shape of the P wave. And if it exists, if it doesn't exist, it could be atrial fibrillation. We will talk about that in another session. Then we look at the PR interval. If it is prolonged, that means more than a big box, then you have first degree heart block. And we look at the shape of the QRS complex. Here it is normal, but in the case of a PVC, it is wide. And then the Q wave, ST segment, and the T wave to see ischemic changes. So we have our diagnosis here. It's a PAC, and here it's a PVC. A PAC is a premature atrial contraction, and a PVC is premature ventricular contraction. Okay, thank you for your attention, and see you next time.